And our buddy Dr. Kevin Kavanagh, he is a retired ENT from Somerset, Kentucky, and he is also the founder of an organization called Health Watch USA that has kind of caught on fire. Dr. K, good morning.
Good morning, Jack.
You recently had some pretty serious surgery. How is your health?
Slowly getting better. It's tough coming back, but I do pretty well if I just sit down and do kind of tasks that aren't very physical. So health is improving.
Yeah, I haven't had surgery, and that's my theory. Sit down and don't exert yourself. That's my credo. Hey, I don't know if you saw this story or not, but I did pick it up earlier this morning to share with you. If you are planning on taking a vacation to Costa Rica next year, you want to make sure that you're vaccinated, because starting January the 8th, travelers will have to show proof of vaccination against COVID-19 or you will be turned away. Businesses requiring the proof include gyms, restaurants, hotels, casinos, and bars. If you are traveling with children 12 and under, they do not have to show proof of vaccination. As for not requiring proof of vaccination, Essential Costa Rica says that's essential services such as supermarkets and pharmacies will not require proof of vaccination. So just a little heads up for folks who may be heading to Costa Rica, make sure you are vaccinated. So where do we go from here, sir?
Well, I think getting vaccinated and talking about that is a very good area to go to, because the United States is far behind most countries in the world that have a industry and economy like we do. As I said, we're behind Cambodia and even Puerto Rico, which is part of the United States but not an official state. They are far ahead of the United States. 89% of adults are fully vaccinated, 71% of their entire population. They also have mandates, but it's not politicized like it is here. And that's, to me, very, very concerning. You know, we have lawsuits going on, and we really need to put that all aside, get everybody vaccinated. If you don't like the method that everybody became vaccinated, then show your views at the polls. Don't go around unvaccinated. You put everybody at risk. Our healthcare systems are strained. Supply system is strained. And that may not go away unless we get a larger percentage of our population vaccinated.
Now, there are eye dangers associated with hand sanitizers. Can you share that story with us?
Yes, the FDA put out a warning that if you get alcohol-based hand sanitizers with 60% or more alcohol in them into your eyes, you can cause serious injury. And if that happens, you want to wash your eyes out immediately with water. As you know, and I've said this a long time before, I just use alcohol-based hand sanitizers when I'm not at home or I don't have access to water. Otherwise, I just use soap and water. That's what we use to clean our groceries. That's what we use to clean our countertops. We use to clean our hands with. The virus is a protein lipid type of an entity. It has a protein lipid capsule, and theoretically soap and water should deactivate it. So it not only will mechanically remove it, but it will probably deactivate it. And I wish early on soap and water was stressed more.
Now, there are some deer, apparently a lot of them up in Iowa, that have the coronavirus infection. Tell us about the implications of that story.
Yeah, this is, I think, very concerning. And this follows an earlier story back in August, where at that time, 40% of 385 samples from deer taken from Michigan, Pennsylvania, Illinois, and New York were positive for coronavirus. This is a report that's coming out of Iowa, where 80% of the deer that were sampled was positive for the coronavirus. So it looks like, to me, the coronavirus has set up an animal host. So when you talk about herd immunity to get rid of the virus, that's probably not going to happen if you just concentrate on people. You know, you talk about third world countries, that's a big problem. But now it looks like this virus is in animals. And if the virus is not making the animals sick, they can then pass it among each other, and it will serve as a reservoir for reinfecting people. So the bottom line is, if you shoot and kill a deer and you approach it and you're going to dress it down and get the meat, you want to wear gloves and you want to wash your hands afterwards. It's very unlikely that once you cook the meat, you're going to get the coronavirus. I don't think people need to worry about that, but you should be bringing gloves along when you start to dress the deer and get the meat.
Okay. Now, America has no endemic COVID-19 plan. Is that something serious?
Yes, it is. And you've heard this on the show. The plan is we just ignore the virus and go back to normal. That's not going to work. I mean, you're not going to be able to get the workforce back up and running unless you make workers feel safe. Same thing as with teachers at schools. And if we got to live with the virus, this means doing things differently. Part of that is going to be vaccinations. Part of it is going to be supplying good PPE to workers so that they can work safely. And of course, some people will say, well, it's my right not to do that. Well, if that's the case, you've got a large group of people, even larger, who don't want to expose themselves to the virus or to work in a dangerous situation. So we really do need to come together as a country to get our economy back up and running. And unfortunately, other nations are far ahead of us at doing this, including some third world nations. So this is becoming actually a national security issue. We need to take the virus seriously, we need to get vaccinated, and we need to follow public health advice. As you know, the test positivity rate in Kentucky is leveled off, and our number of cases per day is starting to level off. And it's leveling off at still a high level, that of test positivity rate of 5%, and cases per day are over 1,000. So we need to get this lower, and we can do it if everybody participates together and views this as a public health priority.
And I know you are a proponent of kids 5 to 11 getting their vaccination, and that has now started since the CDC gave approval. What are your feelings about this now? Have they changed it in any way?
Well, no, they haven't. And of course, this is with the Pfizer vaccine. Now, the Pfizer vaccine has less than a third of a dose for the adults than the Moderna vaccine. And the kids, the young kids, get a dosage which is 1/3 that of adults. So it's 10 micrograms of the mRNA. They've had fewer side effects during the study when the children got this vaccine. And they've had no cases of myocarditis. So it appears to be very, very safe, much safer for the kids than getting the coronavirus. You know, the other childhood illnesses really are not as deadly to children as the coronavirus. The coronavirus causes a lot of problems with our kids. Is it very likely? Well, the answer is going to be no. Most kids do quite well with this, but they can get sick. And as a new study out of Belgium has demonstrated, they can spread this virus to other people. In other words, bring it home, spread it to their caregivers, and their caregivers can get extremely sick. And as you know, Jack, children have lost over 100,000 caregivers to this coronavirus last year. So this is very problematic. We want to get our children vaccinated. That will encourage teachers and bus drivers to return to work, and we can get our society back up and running.
A couple of texts here before we have to take a break. I had the first vaccine shot, Pfizer, in August. Was in a car accident and haven't gotten the second one. What should I do?
I would go on ahead and get the vaccine again. Usually on different types of vaccines, when you break a schedule like that, they might recommend doing the full vaccination over again, but they also may say, hey, just get another vaccine to boost your immunity at this point, and then 6 months afterwards, get a booster. That's something you'd probably have to call up the health department to see what they would recommend.
I've heard, this is another text, I've heard that COVID cases are barely holding steady or increasing in 36 states, and that there is a major surge in Germany and other European countries as well. Does this mean that we're going to need a booster every 6 months for the rest of our lives?
That's unknown. The booster may be part of a dosage schedule for this vaccine. As we talked about last time, many vaccines have 3 to 4 doses before you're considered fully vaccinated. So it may be all you need. Don't be concerned right now regarding surges in other states, because as you go north, they have not necessarily had the Delta surge. And the surges in European countries, we've got to watch that very closely. But remember, they've had different vaccines. A lot of those countries had the Oxford AstraZeneca vaccine, which may not be as effective against some of these variants. So it's a lot of different variables there, but is something we need to watch closely.
Dr. Kevin Kavanagh, we have a friend who is a pilot and flies all over the world. His name is Ken, and he's in Germany right now, and he's texted us that COVID positives are on the rise, but lockdowns aren't happening because the hospitals are not being overrun. Folks are just dealing with the virus at home. Thought that was rather interesting. And let's see, let me go back to the top of my list here. What does the doctor think about mixing Pfizer with the Moderna booster?
Well, the FDA says that it is okay to do that. For me, I would try to stay with the same mRNA vaccine that you had. I will tell you this, that if I had the Johnson & Johnson, personally, I would get an mRNA vaccine such as Moderna. I wouldn't stick with the Johnson & Johnson, but that's just my preference. But that is okay to do according to the CDC.
Randy says he has a small 12-year-old son and wants to know if he can opt to get him the smaller dose of the vaccine.
That I don't know. I would talk to your doctor about that. It is not only related to size, but when they talk about dosage, they're really looking at maturity of the immune system. That's what's important in vaccines. It's not just the size of the child. You know, there's the weight of the child, there's the lean weight of the child, if the drug, whether or not it goes into the adipose tissue, and then there's the maturity of the immune system in the child. And the maturity of the immune system in the child is what is important when you talk about vaccine dosages. So certainly that's on the border, and that's something I talk to your physician about.
Les says, why does he not tell you the vaccinated people can spread it just as much and as easy as unvaccinated people?
Because that's absolutely false. They cannot spread it just as much or just as easy as unvaccinated people. There have been studies that have shown that. A study out of Israel. Can you spread it when you're vaccinated? Yes, but it's not as much. If you are spreading it, you will wind up spreading it for a less amount of time, and you shed less virus. And of course, you're less likely to get infected, and you're not going to spread it unless you are infected. So that is misinformation. A lot of that has, I think, roots in people who want to do our country harm that are spreading it on the internet. And believe me, if you're getting your information, your healthcare information off the internet, that makes about as much sense as reading what's in your spam folder of your email. I mean, it is totally unreliable from what I've seen. You've got to be very careful of your sources.
And one more, can vaccinated people still be carriers and spread the virus?
Yes, they can, but not as much as unvaccinated people. If you go to the CDC and just look at the hospitalization data, over 90% of those people that are hospitalized are unvaccinated. And of course, if you're hospitalized, you have more severe disease. More severe disease, you would be more likely to be spreading the virus. So unvaccinated, you spread the virus more. Vaccines are not 100%. No vaccine is, but it's an important layer of armor, as is wearing a mask. And that's why people need to do both.
Dr. Kevin Kavanagh, thanks. We'll talk to you on Monday.
Thank you, Jack.